I was an NFL cheerleader for 6 years for the Philadelphia Eagles, go Birds. And I enjoyed my time with the Philadelphia Eagles, and that was very intense. So my levels of working out is like probably 2 to 3 times a normal person going into the gym. My name is Marla. I was diagnosed with psoriatic arthritis actually about 2 years ago. I started to develop some type of just nonchalant joint pain. Just very subtle. You know, I wake up in the morning, it was a little stiffer in the morning, and you know, I sort of chalk things up to age. I was a gymnast and a dancer my entire life, so I said, okay, this is payback time. You know, my neck, my joints, my wrists. But when I realized that it really started to be a problem, when it was really starting to interfere with my activities of my daily life, waking up, brushing my teeth, I noticed I couldn't, you know, unscrew even just the toothpaste. It was becoming a challenge. I would come downstairs and just holding a frying pan was starting to hurt my wrist. I couldn't even lift what I was lifting at the gym, and I work out typically 4 to 5, 6 times a week. And so now I was dwindling down to just pushing myself to get to the gym once or twice. Just how I felt on a day-to-day basis, it was devastating to me, because this was something that is difficult to diagnose and difficult to treat because everybody's activity level is different. I've been an RN for a long time, and I talk to a lot of doctors all the time and kind of brought this up, and they said, well, you should just go get some blood work and just kind of see what's going on, you know, check some markers and see what's happening. So I went, I said, let's go see a rheumatologist, an arthritic doctor, someone who actually specializes in this field of inflammatory joint and muscle diseases and things. So I discovered Dr. Mishra. When I first met her, she was very conservative, which I was happy with, because I didn't want to just jump into a plethora of diagnosis and treatment and things like that, because, you know, things were still kind of subtle. So she was so patient. She moved me along, and she talked about what the future looked like, and that if this is A, B, and C, we can get ahead of it and treat it so that you can have the best life, you know, that you're not going to be affected by these conditions, and you'll be able to do all the things you do. I know how active you are. I want to keep you back to where you were. And within the first 3 months, I started to feel better. And it was like a weight has literally been lifted off of me. Dr. Mishra sat down and explained to me all of the risks, everything that was involved. Let's try this. If this doesn't work, we can go down this avenue and see how you do. Well, I'm about 6 months in. I feel so much better. The last couple of months I've been able to get back to my normal routine, which is great. What I would say, first of all, when you're looking for a doctor, I think the most important thing is to pick a professional that, number one, has the experience. Going to see somebody like Dr. Mishra, who is above board of any of the doctors that I've ever dealt with in this profession, in this specific area, she was amazing. And I really felt like I trust her. My message to everyone is to, number one, take every day, one day at a time. Push through whatever you're feeling, because there is a light at the end of the tunnel. So we will continue to get better. And even if you're incrementally better than you were 2 weeks or a month ago, that is progress.